Hello, you guys. It's your favorite nurse, Nurse T. Today, I wanted to share with you guys what I would recommend would be the 5 types of medication that all households need to have in their medicine cabinet. Before I go any further, I want to tell you guys that when you are caring for your loved one at home and it involves you giving them medication, it is important that you know allergies, what medications they are currently taking, and you must know if they have any interactions with the medications that I'm about to inform you of. I want to say that if you are taking care of your loved one at home, you do give them these over-the-counter medications. If their symptoms do not improve in 24 hours, you should seek medical advice. As well as with most healthcare insurers now, insurance companies, they have, what are they called? Nurse lines, where you can call your healthcare provider and explain your situation over the phone and get recommendations on what is best for you and your loved ones. So as well, use the nurse assist line that is provided by your healthcare provider. The purpose of this video is not only to help you guys get educated and be able to care for your loved ones, but it is also to prevent the need for emergency room visits. And with emergency room visits, there are oftentimes deductibles. I know I took my child to the emergency room and it was a $250 deductible. So it's to help limit that out-of-pocket cost, as well as if there is not so many frequent visits to the emergency room, then the emergency room physician can dedicate more attention to patients that are gravely ill. Now, the 5 medications that I would recommend that should be in every medicine cabinet, one is a pain medication. It can be a Motrin, an Advil. You can use that for different types of aches, muscle pains, joint issues. The second medication is a fever reducer, such as Tylenol. Also, let me clarify, I'm not promoting any specific type of brand of medication, but I'm just saying the types of medication that would be beneficial to have in your home. So you have a pain reliever, a fever reducer. You want to have something that helps with congestion, something similar to a vapor rub. Now, also, you guys have to take into consideration the age of your loved one, the weight of your loved one. And so what is recommended is that you read the instructions on the medication bottle, which will give you directions on the dosage. So we have a pain reliever, a fever reducer. We have something to help with congestion. I would recommend something to help with upset stomach, like a Pepto-Bismol, Maalox, Mucomag, because often we have our children, they eat snacks all day, and then nightfall they're complaining of these tremendous stomach pain, stomach cramps, and you don't know what to do. You rush them to the emergency room, and boom, they get some Maalox. Okay, so again, the 5 types of medications that I personally would recommend: a pain reliever, a fever reducer, something to help with congestion, something to help with upset stomach, and last but not least, something to help with a cough. something like a Robitussin, something to that effect, especially in this season, flu season. The climate is changing, the children are back at school, and germs are being passed around. Cold and flu-like symptoms are prevalent. So again, if you're able to care for your loved one at home, there's benefits to that. Again, you save money through the deductible. You allow the emergency room physician to be able to dedicate more time to gravely ill patients. And then you will be like a superhero to your loved one. Now, again, I want to reiterate that if your symptoms does not improve within 24 hours after caring for yourself at home, then most definitely come to the emergency room. Also, it is beneficial if you use your healthcare insurance, the nurse line. Again, most healthcare insurance, they also want to reduce your ER visits. So now they are putting and implementing all of these ways that you can be helped at home. So this is your girl Nurse T, your #1 go-to nurse, and I hope this video has been helpful.